Thank you for tuning into my latest video. So I have a patient who attended with a fully blocked impacted left ear. This wax plug extends all the way from the entrance of the ear, where we are at the moment, and we know we're near the entrance because of all the cilia, all the hairs. So the outer third of the ear canal, the cartilaginous portion, which is semi-malleable, semi-sensitive, that's where you find all the hair follicles. The inner 2/3 of the ear canal is the bony part of the ear canal, and there shouldn't be at least any hair follicles found on this bony part of the ear canal. So I'm just using microsuction here, and the patient advised that they've been using drops, but you can see from the consistency of the wax, it's still rock solid. It's like a boulder. So I've just inserted an ear hook, and I'm just trying to penetrate inside the plug of wax, and it's acting almost like a hammer and chisel. I'm going into the boulder of wax with the ear hook, and it's cracked the lump of wax, and this outer portion of the wax plug has become detached from the main body of the wax, and we've just managed to remove that. And this is all dead keratin, so this tail that you're seeing here, it's dead skin. If you continue to watch, at the end of the video you'll see some more skin, dead skin that I've peeled, and the skin I peel a bit later is a bit fresher, and it's more of a see-through white colour, whereas this has oxidised the skin, so we know the skin's been in the ear for a lot longer, and it's oxidised and it's turned into a browny colour. So I'm just using a microsuction Zollner suction probe here, just to gently just wriggle this dead keratin away. Now the patient has got very narrow ears. The patient themselves are very petite, and the ears are very narrow, but so I was astounded by how much wax that we managed to remove from this ear. She could barely hear a thing when she attended, and it's not often I say to patients that I actually feel their relief when I end up cleaning their ears, and I definitely, most certainly felt the patient's relief when I cleaned their ears out. So again, just using microsuction here, and it's a little trick here. So for all the clear wax delegates who come to the course, or anyone else who performs earwax removal, so this is the patient's left ear, and so the first bend, so there's two bends of the ear canal, and the first bend hovers to the right, and then the second bend hovers to the left, and then after the second bend, the ear canal more or less is straightened. So if you're doing the left ear, on the right, so in the first bend, so when the ear canal curves right to the right, there's a little blind spot there, where wax can become attached with dead skin. And if you can manage to loosen that, so it's kind of this blind spot on the right hand side, just where this cartilage is to the right, just here, just where I am now more or less, but a bit because I'm a bit deeper now, but a bit further out, more lateral. If you can dislodge that, you're halfway there to removing the plug of wax. So again, just using microsuction and just gently trying to move this plug of wax slowly forwards. Now we're past the second bend, so the cartilage to the left is the second bend. So this is the cartilage to the right you saw as I entered, that was the right, and the cartilage to the left, that's the second bend. So we're now beyond the second bend, and this is where the ear canal straightens, and we're on the bony part. So past the second bend is where the ear canal becomes a very sensitive bony part, and you've got a very thin layer of skin, less than 0.1 millimeters in thickness, coating the bony part. So we've got to be really gentle now on this part. We'd be gentle anyway, even on the cartilaginous portion, but with the cartilaginous, the outer third, we have got a bit more give, because it is made up of cartilage. So now this wax plug is really dry. So as this wax plug is getting bigger and bigger, it's compressing against the bony part of the ear canal, and the patient was reporting severe otalgia, so earache, whenever they chewed. And it's hardly surprising because, as I said, the consistency of this plug of wax is like stone. So I think I'm going to go back in with an ear hook just to see if I can glide it in. Again, we're on the bony part, we're going to be really, really gentle. I'm just trying to roll it forwards. But the plug of wax, it's too hard, and the ear hook just ended up ricocheting against it. So just put some olive oil earwax spray into the ear, just dosing that. And I think I'm going to suction whilst the drops is in the ear. Let's see. So this is the first bend of the ear canal to the right, the cartilage just to the right, and you see the left just there. So I've just stretched the patient's ear open because the ear canal is quite narrow, so just retracted the pinna. So the pinna is the name we give for the cartilaginous external part of the ear that looks like a satellite dish. And I'm just trying to get a suction grip now. I'm just trying to wriggle. You can see to the right-hand side where I'm lifting this plug of wax off the canal wall, it's quite red, and that's where the compression, this wax plug is getting harder and harder and expanding and growing, and it starts to compress against the walls of the ear canal and become very uncomfortable. So just gently wriggling this forward. You can see it's coming forwards now. So this is the cartilage to the left, that's the second bend. Can you just see where we are now? That's the second bend. And the cartilage to the right, that's just come in view, where the hairs are, that's the first bend. So the first bend is about 0.5 centimetre into the ear canal, and the second bend is about around 1 centimetre. I kind of always think about the ear canal in thirds. If you, on average, it's about 2.6 millimeters. If we just round it off to 3 centimeters in length, the outer third is cartilaginous, the inner 2/3 is bony, and that's where you're going to be really delicate. So again, you've got some dead skin, and this skin is oxidized, so it's been in for a bit longer. And I'm just using an ear hook just to bring this forwards now. And you can see that's why it's so important as earwax removal specialists that that we use the full array of utensils, because they all come in handy and quite often used in combination. So the ear canal's clear somewhat. It's just some dead skin. Now this is a fresher layer of skin, so I'm using a fine end gauge. Fine end gauge is a lot better to remove dead skin because it doesn't clarinet. Clarinetting is when dead skin violently flaps at the tip of the suction probe, and it emits a very loud, high frequency squeal. It's not only deafening for the patient, but also for myself. So a fine end, you tend not to get clarinetting, and you can see how long this tail of dead skin is. It's a lot fresher, so it's freshly secreted dead skin. Still a bit left there, another coating. So it's just some on the anterior canal wall, just past the second bend. Just going to peel that off. And you can see me there navigating the bend. So I'm going past the first bend to the right, then to the left. That's the second bend, and the ear canal straightens. So just some dead keratin at the posterior canal wall, so the back part of the ear canal, but we're medial, we're right. When we say medial, we mean towards the eardrum. Some dead skin there that I've just removed. And where I am now, the ear canal narrows. We call that the isthmus. There's a narrowing of the ear canal, about 0.5 centimetre away from the eardrum. And that's called the isthmus. So just some dead skin. You can see this is now we're more lateral. We're on the outer part of the ear canal. So there's just some dead skin at the base. It's completely clear, and you're going to see a final view. So that's the first bend, second bend. This is the isthmus, and beyond the isthmus, you've got the tympanic membrane, the eardrum. So that looks nice and healthy.